We will talk about insomnia. Insomnia means difficulty in falling asleep or staying asleep. Insomnia affects around 30% of population at some point of their life, but chronically it affects around 10% of population. It's quite high number. And main characteristic of insomnia is that during the daytime person feels tired and sleepy and fatigue, so it affects person's daily time. It's more common among older women and it's generally more common among women and in older ages. If we say what is the most common cause of insomnia, stress and anxiety is the most common cause. Second most common cause is poor sleep habits. It means staying in social media and scrolling and screen time before sleep and using gadgets and smartphones and computer and irregular sleep time and caffeine before sleep and less comfortable environment for sleep. So second most common cause is poor sleep habits. This poor sleep habit is very complex, and in it we say as using smartphones and computers and irregular sleep schedule also. So both of them are poor sleep habits. If we say mechanism of sleep or physiology of sleep, we have two main players. First is neurotransmitter GABA, which is inhibitory neurotransmitter, and second is hormone, which is called melatonin. Melatonin stimulates sleep, and melatonin is stimulated when there is dark environment and person feels sleepy, and GABA causes relaxation and it also helps person to sleep. This is two main component. And third component is hyperarousal condition. Hyperarousal condition means that person's heart rate is increased, metabolic rate is increased, blood pressure is increased, cortisol level is increased, and at this time and at this case it's difficulty to sleep. So if person is in hyperarousal condition, he may have insomnia. If person has low level of GABA, person can have insomnia. If person have low levels of melatonin, this person can have insomnia also. That is most important physiology of sleep. And what is first line treatment of insomnia? It's cognitive behavioral therapy, and let's explain it in based on real life example. For example, we have Sarah, which is 35 years old woman, and she spends 8 hours in bed but sleeps only 5 hours. So first advice for Sarah is to spend less time in the bed. It's better to spend only 5 hours in the bed, so spend less time in the bed, but Sarah will have more stronger sleep drive. It's important to create stronger sleep drive. It's first step. Another step is if Sarah will go to bed and for 20 minutes she is not asleep, it's better if she get out of bed and go into next room and start doing anything which is not very active, and maybe she work, of course light work, not very heavy work, and wait for her sleep time. And when she will feel sleepy, she should go again for sleep. So it's better if you wait only 20 minutes into bed, and if you are not asleep, it's better to get up and do something until you will not feel very sleepy. Third component is that SARA restricts caffeine after afternoon, reduce screen time before bed, and create more comfortable, cool environment and more comfortable bedroom environment for her to aid sleep. Also, Sarah starts practicing deep breathing and mindfulness breathing to start learning muscle relaxation and body relaxation generally, and reduce stress and anxiety. So this deep breathing technique and mindfulness breathing is important part. That's a part, that's whole part of cognitive behavioral therapy in real life in case of insomnia. Of course, this it's not universal formula, it's only one example. And now let's discuss medications, supplements which are used for insomnia. Melatonin is first and most important. Melatonin has most studies and researches, and it's confirmed many times that it's effective. Also, valerian is effective supplement. Valerian also reduces anxiety, depression, and also aids sleep. Also, magnesium supplements are popular because they can reduce stress hormones, cortisol, and they can cause relaxation of patient and aid sleep. Also, from prescribed medications, benzodiazepines are commonly used, such as lorazepam or temazepam, but they have many adverse effects and side effects like dependence. So it's not advisable for long term, only short term, and if it's possible to avoid such medication, it's better to avoid. Also, non-benzodiazepine sedative hypnotics are popular, such as zolpidem, ezopiclone also, and zaleplon also. Sometimes they called the medications, and they affect GABA receptors, and they increase level of GABA and they increase relaxation. Also, melatonin receptor agonists are popular. They are also effective. That's all I wanted to say about insomnia. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.